I always tend to see liquid biopsies and tissue biopsies as complementary to each other, but in the end, there are indeed some advantages of using a liquid biopsy compared to a tissue biopsy, and that's actually that the sample collection is feasible in all patients. Sometimes with a tissue-based biopsy, it is and there still remains an invasive procedure. Technically, it's not always feasible. And it's also not free of pain or risk for the particular patient. Whereas if you then actually go to a liquid biopsy, performing a peripheral blood draw is feasible in all patients. It's fast. It for sure gives a lot less, side effects for the patients. And very importantly, what we have learned from concordance studies between a liquid and a tissue biopsy is that actually you can get very concordant results. So meaning that the liquid biopsy as such is indeed representative of the tissue biopsy. With that added extra layer of evidence is that it actually gives you more insights into the tumor biology than compared to a single site metastasis biopsy, because we have learned that there is also so-called spatial heterogeneity. The molecular fingerprint that you can get out of one single site metastasis biopsy does not necessarily need to reflect the overall molecular fingerprint that is present in all metastatic lesions. And this is actually the nice thing about a liquid biopsy, because you are getting this signal, a kind of average signal of the overall tumor burden that is present within the body at that moment in time. Another advantage of using a liquid biopsy is, of course, that you can do this sequential analysis of repetitive sampling. It's very easy at each time that a patient is needing to switch for a therapy to actually perform a new liquid biopsy that you can actually monitor longitudinally what the clonal dynamics are within the tumor burden of that particular patient. Repetitive taking repetitively tissue biopsies is, of course, less feasible in clinical practice.